Hello everybody, my name is Camille and I'm a PhD student at Tufts University, and we recently conducted research on household disinfection intervention that I'm going to introduce you. So there is growing evidence suggesting that person-to-person transmission within households might play a role in cholera transmission. Therefore, infection control interventions such as household disinfection are recommended. In cholera outbreaks, there are two common interventions: household spraying, where a team disinfects cholera patients' households, and household disinfection kit distributions, where cleaning materials are provided to patients' family members. Currently, both interventions lack evidence on epidemiological impact. Additionally, spraying has been questioned due to the risk of stigmatization. Therefore, international agencies recommended kit distribution. However, spraying remains widely implemented while kit distribution is not. And as such, there is a lack of consensus on the implementation of household disinfection intervention to prevent cholera transmission. Therefore, to provide evidence on these interventions, we intended to conduct mixed methods field evaluations of household spraying and disinfection kit implementation. So we did evaluate spraying interventions, and the results have been previously published. However, we were not able to identify any kit distribution programs for evaluation. As such, we decided to try to understand why kit distribution programs were not being implemented despite international guidance. So to meet this objective, we conducted interviews with 14 implementers on household disinfection interventions to understand implementers' current knowledge of successes, barriers, and recommendations. We also conducted a pilot study in Haiti to evaluate the efficacy of different training modules on household disinfection kit use, as it was identified as a potential barrier during the interviews. The study included two different training sessions, a lecture-based session and a session with demonstration of items presented in the kit. And we assumed the demonstration session would lead to better cleaning results because of the increased educational components, although it requires more logistical and financial resources. In both trainings, a 0.05% and 0.2% chlorine solution were recommended to clean dishes and surfaces. The study included 20 households participants, and more than 300 surfaces were sampled before and after cleaning with the household disinfection kit to assess bacterial reduction on surfaces. Results from the interviews show that all informants were familiar with household spraying, but that non-national level informants knew what the kit was. As such, all preferred spraying. Conversely, all international level informants knew what a kit was, and 60% preferred household disinfection kit distribution. This disparity between international and national level informants may explain the disparity between what intervention is recommended and what intervention is implemented. Because of the evidence gaps, informants discussed different criteria to select household disinfection interventions, as shown in the table, with in green the positive aspects and in red the negative aspects for both interventions. Again, differences in perception were observed between international and national informants. Overall, informants highlighted there were more drawbacks than benefits for both interventions. In particular, informants expressed concerns with households' exposure to bleach in household disinfection kit distribution, the difficulty to implement both interventions, and again, the gap in evidence supporting either interventions. Before the household disinfection kit use, we observed, during the pilot study, we observed the most contaminated surface were the bedroom, latrine, and kitchen floors, which is consistent with previous studies. After kit use, E. coli and Vibrio were reduced on household surfaces, but total coliforms were not. Thus, wiping using the kit can be effective at removing some bacteria, but bacteria exhibit variable tolerance at the concentration we tested. The main differences for participants who attended the demonstration session were significant reductions in both E. coli and Vibrio, and a higher self-reported kit use. These results highlight the need for appropriate and sufficient training for kit recipients. The pilot study also showed a positive kit use perception by participants, with more than 80% of participants reporting liking using the kit, and more than 60% of participants reporting using the correct bleach concentration to clean. So these results emphasize the gap between current policy and the realities of cholera response programs, and underscore the importance of dissemination and training to responders and affected population on methods to prevent intra-household cholera transmission. Additionally, this research highlights the need for evidence to align household disinfection recommendations and to compare both interventions in terms of cost effectiveness. There is also a fundamental need to inform the prioritization of WASH interventions in cholera response and the role of household disinfection interventions to reduce cholera transmission. So I really thank you for listening. I hope you enjoyed this short introduction, and you'll let us know if you'd like more information. Thank you.